So that's the most important thing, right? I mean, the state's going to lose some money over time. The state gets extra money during the public health emergency, and starting on April 1st, the extra money will be 5% instead of 6.2%. In July, the extra money will be cut in half, so it'll be 2.5%. Just to give you a sense, the state has a full year to over time phase down the winding down. Okay, and there's actually a memorandum we have, which we can share with you if we haven't shared the link in here. And from Mass, probably what we'll do is we'll add the link to this so you can just get it for yourself from our former Mass Health Director and Assistant Secretary Dan Tsai, that talks about the phase down if you're really into the specific elements. But the biggest thing that, let me go through the slide. I have with me today, we're not going to do this, is Michael Andrade, and he's here with me because there is a couple of problems, okay, that could happen with this phase down, and they both result in the same thing, which is you lose services for a period of time until you fix the problem. And Michael's the CEO of the Arc of Bristol County. He's one of my close colleagues, known each other for years, even though he's younger than me. And one of the programs does focus on financial and legal supports, including benefits management. And he serves as a board member at ADDP, among other things. The other thing about Michael I want to point out is his agent. He actually has an agency in Rhode Island and Massachusetts, and he's like me, a master's social work and a licensed independent clinical social worker, and really been teaches at social work school as well. Just really, I've always been impressed with him. He's a good colleague, good friend. So he's going to be helping us on the benefits part of this. That's just so essential. To keep in the front mirror instead of the rear view mirror. So just to share with you, basically at the budget. So this is part of the phase down, is part of the 1.7 trillion, just trillion, not a zillion yet, 2023 omnibus spending plan. And that's a big deal, right? And it's a major increase for Social Security Administration is in there. Why should we care about that? Well, a lot of people, I don't know about you, are frustrated when they can't get help from Social Security, right? And they end up owing money, or they end up having to pay back stuff for a year. One of very active parents said to me once, "Hey, Leo, I went to our local Social Security office. I checked out, when it's busy." And he goes, "I'm going back in to deal with my daughter's problem. This time of day seems to be best at this one, So it's really like one of those things. If you can't get an appointment on the phone, it gets complicated. And same with the Medicaid office. Which is state-run as Mass Health. The budget, the spending planning extends the Medicaid money follows the person program, MFP, through 2027. So that's the program that gave states additional money to help downsize institutions. And we had downsized quite a bit, but we still used that program pretty effectively. And our office, I think, got reopened last year when they heard there was new money available. 13.4 billion increase for SNAP. That's food stamps, just in case you're wondering. And that's something, since that's a discretionary program. And, most of the budget in our federal government, goes to three places, most of it: defense, interest payments, right? And entitlements. Social Security and Medicaid, right? Medicare. Big win also is in 2026, ABLE Act will cover people up to 40 experience disability. Actually, I thought it was 46. Is it 40? Michael can tell us. And then
it is 46.
It is 46, right? That just shows I was thinking about too many things at that moment. I'll have to update it before it gets sent out. You know why I might have done that too, because they extended to 2026, and I thought it was odd probably to do sixes or I had the TV on. And then why is that important? Michael will talk about that. I'm not going to take away any of his sunshine. Language regarding electroshock. There's a new pathway for the FDA if they decide to do it again, and hopefully they will. But yeah, maybe they decided to do it because they knew they'd lose in court. Who knows, right? You never know. And then the ending of the Public Health Administration emergency, and that basically means states can begin the disenrollment process. Extra federal dollars, I already mentioned that. And then there's also this additional reporting requirements that are part of the bill. So, and that again, with the link to Georgetown, which is right here, you will have it. You'll be able to read about that, okay? So I'm going to introduce Michael into the discussion now because, we really need to think about, I'm going to get rid of the chart for a minute, okay? And have you come on board and share a little bit about, what people should worry about. And again, thank you so much for joining us today, Michael. Welcome.
Thank you, Leo. Thanks for the warm welcome and great to be here. As Leo referenced, we have lots of things changing. Starting off with some good news, we are, for the first time in many, many years, seeing a pretty significant increase for folks who are on Social Security and SSI. So 8.7% COLA that folks are going to get. So we're excited that that's going to give people more resources. However, on the flip side, especially with the pandemic, the asset limits haven't changed. So part of the challenge here is since 1989, the same asset limits have not been reflected in terms of any kind of inflation or any kind of other adjustments. So those asset limits that Leo just referenced, the 2,000, 3,000 if you're married, still hold true for folks who are getting any kind of supplemental programs, either through Social Security and Mass Health. And the importance of that is because so many individuals' benefits tied to Mass Health. So when you think about our day habilitation programs, adult foster care, many of the new waivers under the Department of Developmental Services rely on that funding. And if someone gets kicked off from that funding source, it's very difficult to try to get back on. So what I'm going to hopefully do over the next few, not today, just kind of give you some highlights of it, but then we'll actually do a more comprehensive training review, is really help navigate the different options people have to understand. The great news is there are tools out there, both at a state level and a federal level, towards helping people trying to figure out how to maximize these dollars so that they're not just spending them frivolously. Because the goal here is not to just have people just go spend money on things they don't need. It's being mindful and thoughtful about what are the tools and what are the options available to individuals and or families towards really helping maximize their resources in understanding these options. We work with them every day, and there's not a one size fits all. And many financial planners, there's lots of different individuals who are looking at how to help families navigate this system. I'm hopeful that we'll be able to share some resources, specifically around some of the latest tools that we've been given with the Achieving the Better Life Experience Act, and understanding that further. Leo referenced that there's new legislation that is passing. For those of you who don't know what that is, that it enables an individual to actually create an account where they can actually then have up to $17,000 as of this year set aside that they won't affect their SSI or their Mass Health benefits. That is a big, significant difference because many years ago, folks didn't have a lot of options towards having actual funds in an account that they could access. It can be managed by the individual, it can be managed by a guardian or an organization supporting them. But part of that is maximizing the benefits so that they can make sure that there's no adverse impact to their SSI or to Mass Health. So there's another tool in terms of pooled trusts that is another option that folks can engage with. But then there's different versions of things towards making sure that people can benefit and access those resources. And again, depending on what the person's understanding is, depending on what their long-term needs, there's all these different options that they can engage with towards maximizing so that they're not falling off this cliff, as we call it, and not having any kind of adverse impact. But part of that is understanding what they are. And in my opinion, every family is unique, so we have to think about each unique approach. So in the next few weeks, we'll be articulating kind of what are these vehicles? What are these tools? What are the differences? What are the things that may work well for one family, but might not work well for another individual? And being able to kind of understand the nuances and then being able to kind of identify what are the processes towards moving forward for each unique individual and situation. The ABLE account, and I'll just kind of give a little understanding about it for folks who've never heard about it. I'm here in Massachusetts. It's managed through the MIFA, which is the Massachusetts Educational Finance Authority. And what they actually tied it with was the IRS college saving plan. So it's a 529, but it's 529A. So it's a subset of the IRS code to allow families or individuals to set up these accounts, very similar to college savings plan, where each year a certain amount can be set up For now, this year, it's $17,000. It started off as $15,000 when this program policy started. And our hope is each year will continue. And then right now, the key requirement is the onset of disability must occur before the age of 26. So for many folks that we work with in our community, many folks who have intellectual and/or development disabilities fall in that classification. However, we have other folks who may have had an acquired brain injury. And if right now that acquired brain injury occurred at 27, they are not eligible for the ABLE Act. We are waiting for the new legislation to take effect so that once the new standard of 46 occurs, then from there we can begin enrolling. Our initial goal when the ARC of the United States started this advocacy was to have no set age limit of onset. However, part of the bipartisan negotiation was to then add that age limit requirement in hopes that over time, we will eventually eradicate it and there won't be a specific one. But for now, we work with what we got and we begin to help people. One of the other pieces around the ABLE accounts is that it doesn't necessarily need to be just done here in Massachusetts. As I mentioned, the Massachusetts Educational Finance Authority ties it back with Fidelity. So here in Massachusetts, the program we call it is Attainable. That is the Massachusetts ABLE program. There are other states that have various different programs. We are working with one right now called Stable out of Ohio. So individuals can choose which programs work for them and the benefits of which unique situation meets their respective needs. And there's no wrong approach. It really just identifies what it is you're looking for. The nice part about the ABLE programs is it provides a debit card so that that individual and/or family member can support that individual with what's called their disability-related expenses and be able to manage different things. I see a chat question here. Is it true that when the owner of an ABLE account passes away, the money will go to Medicaid or Medicare? The funds can't be left to the beneficiary, correct? So what happens similar to pooled trusts with the ABLE accounts is that when the person passes away, Medicaid gets first rights in terms of any funds that were provided on behalf of that individual. If there's any remaining money, so for example, let's say that I pass away and I've had $20,000 of Medicaid services provided to me, but I have $30,000 in my ABLE account. Well, then the way that the ABLE account will close out is that they will send the $20,000 to Mass Health because that is the claim they put towards the services that were provided to me since I enrolled. And then the $10,000 difference would be left to my beneficiary. So, and that is very similar to what we would do in a pooled trust account or a self-settled account. Trust account. What is different is then when we think about what's called third-party trust accounts. And that's when we'll get into it further in terms of understanding when a family wants to set funds aside, how the same provisions don't apply. There are key elements and key distinctions in terms of what benefits will be available to those individuals and their beneficiaries. So there are some similarities with some of the programs we have, but then there are some key distinct differences in terms of how we look at different pieces towards managing those different approaches.
Excellent.
So I see in terms of some folks, the hesitation around putting the funds in place. Again, it's not a one size fits all. So part of this is as we think about different tools, for that individual, if they want to maximize their services and making sure that they have those services, then we want to make sure that these options will help them. But again, we're going to get into a more detailed discussion in a few weeks when we do a really comprehensive review. And I'm going to really focus on the differences so that people can understand. And then from there, they can start looking at their own roadmap to see how it applies to them and what are the best options for them. Because again, we work in this every day. And one of the areas why I'm intrigued by all this is I realize the importance. And I also understand that as a social worker and as an agency leader, there's days I don't get it. I have to look and research. So I can only imagine where folks who aren't dealing with this every day, how they need to try to research. And so I want to make sure that we're a resource towards helping navigate and guide people in the right direction so they don't make the mistakes and they can make sure that they can maximize the benefits that they have.
So in fact, Michael, you're going to be doing training on February 1st at noon. And I think that's a Wednesday, if I remember right, with Carrie Mahoney. And your goal is going to be to help people really more in depth during this wind down. And you're going to probably have a lot of agency guests. And so as a family member, I wouldn't be disillusioned about showing up at that, because they're also going to have some of your basic questions, because they have people they're payees for, and they're very concerned about how to spend down the darn money, so they won't lose their benefits. And I just want to also congratulate Michael on setting up the arrangement with Stable of Ohio, because there was no way in Massachusetts, if you were a corporate payee, right, to be able to do it through Massachusetts MIFA, and Fidelity. So the fact that, he went through a trial process, he checked it out with his team, it worked. So now, with confidence, so a lot of it, really, the folks will be on this, and I'm sure we'll have a month or two after that, a more general training once again, as you've done. I think you did in the beginning of COVID, you did a pretty in-depth one. It might have been a little later than that, right? You did, and that might be Mary Ann or someone from Berkshire will join you for that. But Lucy asked, will Enable account work or a bank account allow donations to be made to a service provider organization? I don't think so. The donation from Enable account.
Not while the individual is alive. So all these programs require what's called a sole benefit rule, or a disability related expense. So, but upon the person's death, if they want to bequest funds to a nonprofit organization, either in a trust and or Enable account, they can, so long as there's money available. So that same approach would apply. If I had $30,000 and there's $10,000 left after Medicaid says they want their piece, then you absolutely can designate it to a nonprofit organization.
And Michael, on the question, I think Lucy's asked about Social Security monies in a bank account. Yeah, I think you can give a donation out of your bank account, that even if you're getting Social Security, you can't go crazy. And I don't know what kind of are there any limits on that in terms of Social Security being concerned if they see you giving like $1,000 to whether it's the Arc of Massachusetts or Bristol County out of your account?
So the way that Social Security works is once your required expenses, your housing, your living expenses are paid, the rest of it is discretionary income. So they can do whatever they want with their funds. So if they want to give, not $1,000, because when you think about the average, but so let's say they wanted to give a $200 donation to the Arc of Massachusetts, they absolutely can do that, because that falls in the category of discretionary income. As far as trusts and Able account funds, well, now there's rules about where those funds can go. So we have to make sure that we follow those rules and ensuring that people are applying them appropriately. Again, typically where we see that there's donations made is a bequest process after they no longer are living, that they could actually execute specific arrangements.
So the other thing, Lori's asking about other guidelines or restrictions. I think it's more flexible in the Able account than it tends to be in other things. You want to, like, and she even mentions a down payment for a home. And
so
in
the Able account, so one of the exciting things about when the Able account was created is SSI has been extremely specific as to using SSI funds for we have to specifically for housing and all those other key elements. So housing and utilities. Trusts were unfortunately, we were limited as to using any funds for folks on SSI for housing and food costs, because folks under SSI says, we're giving you this money for those kind of needs. If you get the money from a different funding source, well, then they would reduce your allocation. The Able account, when it was created, we specifically advocated for broader language so that folks who have an Able account can use those funds for housing and food related costs, and they do not count as assets. So that is yet another key distinction in terms of a benefit that the Able account will afford versus a trust account.
And how about a down payment from Able versus other resources? We have to look that up, right?
Yeah, so the down payment, that's when we get into a better situation around looking at a trust or something like that, because I think unfortunately, it's not so much the acquisition of the home that I worry about, it's the long-term maintenance.
Later on.
Right.
Also later on, could they say, hey, you made a down payment, some of these funds, and it's still there, that asset, and we own a piece of that asset for the payback, yes or no?
Correct. So that's another consideration we'd have to think about. How will Social Security and Mass Health interpret that? Because the Able account itself can't hold property. So that would be another key distinction.
So you wouldn't want to leverage it. So in fact, they get even more than they would have gotten because you put now family money into that house stuff, and whatever, right? And so you sort of set up a tough situation. I don't think you have to worry about the stock market for able funds, Lucy, right? I think they're
So right now they are invested. So part of that is you get to choose with the most able accounts. They will ask what level of comfort are you. So you can either choose a very conservative model investment or a more aggressive. So upon actually the applying, you can decide what level of kind of growth fund you want towards moving forward. The stock market, again, as we look at pool trusts and what we've seen with the pool trusts, many trusts haven't used the stock market because it has covered the costs and provided a modest gain. This year is an anomaly, and we're working with lots of investors and kind of seeing what we can do. But part of this is kind of the up and down of the stock market. But I can tell you, just in our experience, our trust program in the past 3 years, barring this most recent year, was returning about 10% return for our individuals, and that's a moderate growth portfolio.
Great. So anything else as we consider the wind down, because we're going to touch on a few other things today, but as people, so the A is make sure you read your mail too, right? Because basically, even though it shouldn't happen, I would assume they try to rule out people in group homes or in DDS caseload from reviewing them for disenrollment. It could happen, right?
Correct. So for many individuals, they just suddenly get a letter saying you've been disqualified. At this point, you can reapply, you have to appeal, you have to go through this process. The key element right now is making sure that getting people under that $2,000, if you're an individual, or $3,000 if they're married, making sure that way, at least both for Social Security purposes and mass health purposes, getting people, again, with the pandemic, had some of the incentive payments people received, and lots of folks haven't been spending as much. Now we're about to see an increase. And again, I understand that costs have gone up, but people may not be spending the way they were prior to the pandemic. So now is the time to take a look at those accounts, get them spent down. And again,
furniture, right? Furniture.
The first question I always ask people is, and I know a lot of folks don't want to think about this, but the reality is we have to, pre-burial expenses, thinking through, can you set up kind of those, can you take care of those arrangements? Because those tend to be a pretty large expense. If it's a smaller amount, then clothes, furniture, what are things that you can do that's
right front. It's at 24, it should be at 32.
Hi, if you guys could be on mute, we can hear you, whoever that is. So people might want to mute until they want to say something. Always a good idea. So Michael, on the funeral plans, I'm used to pretty expensive plans that I've seen in my life. Are there more reduced plans that are good plans that people, what would be like a lower priced, the lowest priced plan that's reasonable that you could find,
So right now, on average, what I've been seeing coming through, it's about $12,000 is kind of the kind of standard.
So you're in the ballpark. You haven't seen it. Okay, I thought maybe there was other options that we had never looked at. Yeah, okay.
But that's not to say that you can't. So let's say you only have $5,000. Well, you can put down a deposit and then from there start paying, so people can start with something. So it doesn't need to be an all or nothing, but again, starting to plan different pieces. And again, it's something that can change. So if you just want to kind of set the basic, if you will, the basic plan, and then say, but I want to really get into the details till later, that's okay. That's
Right.
where you can at least start working and kind of have those funds set aside so that, again, they're meaningful. My intent here is not to talk to people about somehow evading or frauding the government. That's not what I'm trying to do.
No.
I want to make sure that people are being mindful about it, that they're thinking about how to maximize their dollars, and that way they can make sure that they don't run into a problem as they go forward. And again, these things happen before you know it, because of the increase in Social Security and because we haven't been spending as much doing the kind of things because of the pandemic. Next thing you know, you're like, oh my God, I have $6,000 in the account. Well, you got to get it down. You got to see
Right.
it.
Well, I think the funeral plan kind of pre-purchase is a great example of something, if people haven't done, that's, we're all unfortunately, going in that direction one day. And it's a great way to sort of build toward that. And people can get different estimates from people that want to, allow you to do a purchasing plan. It can be an insurance plan, right? Or it can be with the funeral home will have an insurance provider they use. So there's a number of, and I won't dwell on that anymore, but I just think that's a great example. I'm so glad you
I
brought it
just
up.
do want to reference, I see Lori, cremation is about half the cost, depending on kind of what are the things people want to see, in terms of what they build into the package. And again, my approach, what I always tell families first is start off with, what are things you need? Like, can you buy that furniture? What are the things that right now that would bring it down that you can just buy and you don't even need to think about navigating these things? But if you realize that you have a lot more than there is no need right now that's pressing, then we can think about the ABLE or the trust accounts towards moving those funds in place. Or if it's something that's an ongoing need, so someone's getting a much higher amount, so every month they're dealing with this, or they're employed, so they're trying to figure out how do they navigate their employment income. All of these things will be addressed in our presentation on the 1st, so that this way I can kind of walk.
That's great. All right, thank you. That's great. and vacations can be paid for, yes, from the ABLE account. Yes, that's
Yes.
more flexible than a trust account.
The little trick on the vacations is that we just need to make sure that there is a socialization goal that's built into their individual planning. So part of this is that, again, the way that the ABLE account distinguishes the expenses is they have to be disability related expenses. And though the definition is pretty broad and flexible, what I recommend is that people have some kind of vacation goal. And then from there, you got to make sure you're paying for the vacation. We've seen some instances where people were creating like a vacation trust fund. That's not allowed. You have to pay for the vacation. So when you pay the JetBlue vacation, you pay it out, that's fine. But you can't ask someone to hold that money and say, well, this is going to be for a vacation. Kind of like, think about the banks when we used to have what was it? I can't even think about, not layaway.
Yeah.
Fund, where
yeah.
we set aside money. If it looks like any kind of savings account, that's a problem because that would be considered an asset. So
And the need for staff on a trip, and what if the staff is related? Now, the reality is ABLE's a little more flexible. We have no idea how they'll audit it down the road. So they're flexible, but God forbid in auditing that they become inflexible and you're like, it's a sister accompanying, or even though that's totally appropriate, right? If you think about it, if it's someone that needs 24/7 care, they're not probably having a break during the vacation with Jim or Janet, but I do think that's something you have to think about, but a cousin might be a different story, right? Because it's not an immediate family, but that's another piece of it, that if someone needs staff support, correct? Disability.
And we'll talk about the caregiver support, that is allowable. So building it in and then document it in a certain way. This way you're kind of covered from, again, regardless of whether it's a trust disbursement or an ABLE disbursement, both are allowable. It's just making sure that you document a certain way. This way, if it's ever audited, that you're fine.
Okay, great. I want to touch on a few more things. If someone's got one more pressing thing for Michael, feel free to ask, but I also want to let him go. And really, again, February 1st, it's going to be in your PowerPoint. I already fixed the age to 46, and I already put the link in, added the second link for CMS. You're probably not going to want to read the CMS memo, but someone else might want to read it. But that link's there, and as well as the link to Georgetown, that they do a pretty nice job explaining the wind down. And this week, I think they'll have a new one. They call them Wind Down Wednesdays, and they have different things they post. So once you have that first link, you'll be able to look on with them. Probably not necessarily look at it every week, though. It's my hunch is every few weeks would be enough. But the key things here, I just want to add again, like, even if you don't have an asset issue, still watch out for your mail, just in case, right? Your family member or you, if you have a disability, are being inappropriately removed from the docket. It should not happen, but we know what happens, right? With hundreds of thousands of maybe more than 100, right? It could be over 1 million of these are going to go out. I have no idea. And you just want to make sure you're not accidentally caught up in that. Okay, so Michael, just wonderful. So I just want to go up on the PowerPoint one more time and really appreciate the wonderful information you were able to give.
Thank you. Again, look forward to seeing hopefully lots of you on the 1st.
Yeah, you're welcome to stick around. Yeah, totally. If you want. And again, February 1st, I just want to keep reminding people that's in well, were you saying something else? Did I just miss that, Mike?
No, I was just saying thank you. I appreciate
All
it.
right, cool. So I just want to, current slide. So just also what's going on in Massachusetts at this time. And I think, Maura did a great session last week, on what's going on government-wise, but Governor Healy assumed office on January 5th. Had a great inauguration event, and a few days later, Governor Baker and Lieutenant Governor Polito had a goodbye event in the area, and President Spilka and Speaker Mariano were reelected. So what'll happen if you go on the state website and try to find committee chairs? Forget it. I can't even find last year's anymore because basically everything's been removed. There'll be caucuses, both Republican and Democrat, where the new either ranking minority leader and ranking minority chairman, not chairman, ranking minority member of a committee, the chairman of the committee, the vice chairman, assistant vice chairman, they'll all be appointed this month. And I haven't peeked today, maybe up already. I don't remember when the caucus meets. We actually have an orientation tomorrow for new legislators that the team's finishing up the package as I speak. And we're going to be doing that tomorrow at 10 in a small room at the State House, where we would have publicized it a lot bigger. So that's tomorrow, and we'll visit some offices tomorrow. On March 7th, I should have that here. I think I'll edit it one more time. You'll be getting material and updates on the legislative reception with the Mass Developmental Disabilities Council that will be co-hosting, and we'll be asking others if they want to be sponsors of that event. And it doesn't cost any money as an agency to sponsor the event, and we'll welcome people to do that. We're finishing up what senator and what rep are being honored. I actually know who we plan to honor, but I'm going to hold till I make sure my colleagues at MDDC have heard about who we want to honor. And this year we do the senator. And then this is the 193rd session of the General Court, and that's just another name for the Massachusetts legislature. There's about 30 new legislators. What you'll find is, of those 30 legislators, 2 cannot be seated yet because it was close. Oh, great, Lori, we'll add you guys. It was so close, the races. My hunch is one of them is going to be settled any minute. I mean, in court, it'll be thrown out. Another, and whether they appeal or not, though, right? We don't know. A sitting rep did lose the election by 1 vote. So that's pretty wild. So your vote counts, just to be really clear. But I also want to add that we don't know who's going to get appointed as commissioner. At this point, right now, Mary Beckman has been appointed as the acting secretary for Health and Human Services. Former Secretary Mary Lou Sutters will be available for consultation off and on. My hunch is she'll be available remotely. As we had reported previously, A&F Secretary Gronkowitz will start. Gorkowitz, oh my God, I can't believe I said his name wrong. I've known him for years. He will be starting. He'll be starting soon as he's done with his UMass responsibilities. And we look forward to him in the role. He's someone with a lot of experience and knows about disability as well. So just a good person. And we're hoping to make contact with a number of people just to, get things moving, because we have a lot of unfinished business, right? As you know, as administration crossed over, whether it's the workforce or it's the people that, over 2,000 people that still are unserved or underserved, that many of them was, needing a lot of support. And right now, either they're getting that lot of support from family, that month 35, month 36, or they're getting it in a residential setting with not a whole lot of socialization. So that's a big deal, skills regressing, things like that. There's things in a residence that you don't get training on or rehabilitation on or habilitation on that you do in a day program. As much as you may like or not like the day program, it's still better than none at all. Well, in most cases, okay, let's put it that way. I'm sure people have had all kinds of experiences. So these are the kinds of things we're crossing over into, and we're going to be hustling here. And, again, like tomorrow's the 10th, right? And we're having a new legislative reception. In the meantime, bills are due by the 20th, refiling of bills. I'm glad to announce that ADDP and the ARC will be together, working with a state rep and state senator. I'm just going to finalize the key sponsors for the workforce bill for our space. that includes not only our Chapter 257 programs and DDS, Department of Development Services, but also Mass Health Rehabilitation. And we want to do that because we want people to also think about who they're hurting, who they're affecting, who they're not helping enough when we're not putting the right salary out there for the workforce. So we're gung-ho on this, and we'll be announcing who the sponsors are any day. Just waiting. They're reviewing the bill, and they're going to get back to us the next day or two. We also probably have a community college bill, though both Senate President Spilka and Governor Healy have announced they want to do free community college. So, but in one of the cases, I think Senator Spilka's bill, it's people 25 and up. So we obviously want 25 and up isn't bad, but we probably want people who've worked 2 years in our space to be able to get free community college as an incentive, right? To have more people in our space and to be better educated too. So there's a lot of things like that that I haven't even touched on. Our friends, we supported friends in the broader disability community on the accessibility bills, our architectural. There's a bunch of stuff, whether expanding Nikki's law and other things that I'm not going to get into right now. But I don't know if any other questions you might have about the big picture that you want to ask at this time. But I wanted to give you that sort of short summary today. And then next week's Martin Luther King. So the week after that, I'm hoping I'll have a bunch of stuff to update you on. I'll coordinate with Maura what she's going to update on versus what we're going to update on, but on the Monday session. And then soon, probably by the month of February, we may be switching to we'll be switching to a once a month format, except for March, when I've already arranged for Bob Putnam to join me to talk about positive behavioral supports on the first week in March. And we'll be getting something out on that. Really looking forward to his joining us, and but look forward to getting this out. I know I said I'd add one more thing. I'll have to remember what I'm adding. Oh, probably the March date is probably what I'm adding. I was trying to go the other way and it didn't. Here we go. Okay. Just something I didn't go over is, oh, it's not going there. So it's all right. Forget it. Let me stop the share. So any other final things before we call it a day today? All right.
I just have one quick question. Leo, is there anything we can do to kind of influence the next Executive Office and Health and Human Service Secretary?
Well, I think, some stories, short stories and pictures, if people want to share with us and or directly send to them, they'll be, as soon as they appoint it, like Mary Beckman's probably, let's see if she's there now, if they've listed her picture. I'm going to just mass.gov, and then I'll just hit Health and Human Services. Let's see if her picture's there. I don't know if it is. She's acting secretary. I don't know how many. Here we go. Executive Office, Health and Human Services. Yeah, it don't appear to be. Let's see if down there it'll say who's secretary. Yeah, so you got to go all the way down. See all news and announcements. Yeah, so a lot of Baker Polito is still there. Audrey Morse-Gastier was appointed acting director of the Massachusetts Health Connector. But other than that, it looks like they're trying to coordinate whatever they're doing, So right now you'd have a tough time reaching the person, Mary Beckman, but again, she's the interim secretary. I'm not sure what they're looking for secretary. So we'll have to figure it out. What'll sort of happen in the end, in terms of that appointment. But I think what people could do for sure right now is they could think about if they have a new legislator, or if they don't have a new legislator, a House member or senator, they could end up reaching out and just reminding them, because we're going to need the legislature, I think, without a doubt, and that always helps in the dialogue, right? Because the legislature sometimes is part of the, hey, you're spending too much money in this area, too much money in that area. And then if we share with them what our stories are, I think that can be helpful too. But I think organizations like Mass Families can ask to meet with the new secretary and things like that. And I don't know what the status as commissioners is as well. So we'll find that out.
Leo, do you think ArcMass will have any input into the new DDS commissioner?
I don't think so, and I'll tell you why. It has happened that we've gotten calls in the past, not necessarily, well, I mean, the times we've gotten calls probably haven't been just for input on who would be commissioner. But they've been more around major policy decisions from, like, administration higher up. So no, I think they're getting so barraged by people, whether in the campaign or from House members and Senate members that are part of the party, right, the Democratic Party, that, and I would think they see us as sort of friendly, like people, and if we hadn't told them anything during the campaign, that they're probably not expecting to hear anything, or soon after the campaign. So no, there hasn't been any specific outreach as such. We're allowed to send in input, and I don't think we want to probably go there, because if someone other than who we recommend, or if we say anything negative and people are appointed, you know what I mean? It just, it makes it complicated, right? So that's probably, I think people who've been involved with the campaign, I mean, we have informal ways to get input, but again, that again has to be carefully done if it's ever done. We got to be just ready to advocate, right? And some good things clearly that happened, and if not for COVID, maybe we would add some better things happen. But right now we have a serious problem that sometimes people think everyone's got that problem. So how much can we do for our world or our field? But and everyone here knows more can be done, right, for our constituents and families.
Of course.
And that's what we've got to work at tirelessly. So thank you. Thanks for asking that. And everybody have a great week. Look forward to seeing you in 2 weeks. And it's going to be it's going to be more focused on the state stuff. And again, I'm going to coordinate with Maura what she plans to do on week 1, and of her thing, and what I'll do. So take care. Have a great 2 weeks, and happy Martin Luther King Day and Happy New Year.
All right. Thank you. Bye-bye.
Bye-bye. And thanks again, Michael.
Yes.
Thank you.